Hey everyone, welcome to another episode of What the Dementia by Bambu Care. I'm your host, Brianna Wilson. I am a certified dementia practitioner and the founder of Bambu Care. So today we are going to be talking about Lewy Body Dementia. On the last episode, we talked about vascular dementia. So if you missed that episode and you're interested in learning more about vascular dementia, I would definitely check that out. And I'll also put it down in the podcast notes as well, just so it's a little bit easier to find, okay? Now, Lewy body dementia is one of the more complex types of dementia, at least in my opinion, okay? And it's actually recognized as the third most common cause of dementia. But it does swing back and forth with vascular dementia as far as being second or third most common, okay? Now, remember, with any kind of dementia, there's something going on that is causing the symptoms of dementia, and it's significant enough to impact daily functioning. So in the case of Lewy body dementia, it's Lewy bodies that's causing the dementia. And essentially, Lewy bodies are basically like a type of abnormal protein, okay? Now, when these abnormal proteins are deposited on the brain, it creates chemical changes in the brain. And it also causes impairments in the communication between the brain cells. And so in turn, this can lead to impairments in thinking, mood, movement, and behavior. Now, I will say that diagnosing Lewy body dementia can be a bit tricky because in the early stages, it can be confused with other diseases, such as Alzheimer's disease or schizophrenia, okay? And Lewy body dementia is most common after the age of about 50. And it does tend to be more prevalent in men than women, at least by a little bit, okay? Now, it is important to know that there are two separate Lewy body dementia diagnoses, okay? So you have dementia with Lewy bodies, and then you have Parkinson's disease dementia, okay? Now, with both of these dementias, the primary culprit is thought to be the Lewy bodies, those abnormal protein deposits on the brain that are essentially screwing things up. Now, the way to distinguish them can be a little bit blurry, but typically they follow like this 1-year rule. So if the person develops cognitive symptoms within the same year of developing movement problems, it's more likely to be considered dementia with Lewy bodies. However, if the cognitive symptoms develop more than a year after the onset of movement problems, then it's more likely Parkinson's disease dementia. And the reason for this is because not everyone who develops Parkinson's disease goes on to developing dementia. Okay, so if those cognitive symptoms develop more than a year after the onset of those movement problems, it's more than likely Parkinson's disease dementia. But if they develop around the same time as the movement problems, those cognitive symptoms, if they develop around the same time or within the same year, then it's more than likely dementia with Lewy bodies. Okay? So what is the deal with these Lewy bodies anyways? Why do they screw things up? So essentially what they start doing is they start forming these clumps or clusters inside of the neuron or the nerve cell. And this cluster of protein that shouldn't be clustered, right, starts disrupting how the neuron typically functions. And what this does is it starts causing the neuron to malfunction, work less effectively and efficiently, and eventually die. And with this, there will also be a change in the brain chemistry and in the brain chemicals, which results in many of the symptoms that you'll see. Okay, so let's briefly talk about the different parts of the brain that are most impacted by Lewy body dementia. So we have the cerebral cortex, the limbic cortex, the hippocampus, the midbrain and basal ganglia, the brainstem, and then brain regions related to the olfactory pathways. So let's break this down really quick. So the cerebral cortex is important for information processing, perception, thoughts, language, okay? The limbic cortex plays an important role in emotion and behavior. The hippocampus is important for forming new memories. The midbrain and the basal ganglia play an important role in movement. The brainstem manages sleep, survival functions, a person's alertness, and then brain regions related to the olfactory pathways is just referring to the person's ability to recognize smells. Okay, now let's transition into talking about some of those symptoms that you might see with Lewy body dementia. So, you might start seeing visual hallucinations or delusions early on in the course of dementia, a fluctuation in cognitive ability, attention, and alertness. And some days you may even see them kind of like zoning out and staring into space. Maybe they're not really as responsive to you. You'll start noticing issues with their ability to multitask, problem solve, exercise good judgment. They may also have poor communication skills and auditory comprehension skills, or they might not really be able to interpret visual information the way that they were previously able to. You may start noticing slowness or stiffness of movement, tremors, difficulty walking. They may also have poor balance or a shuffling gait or rigidity or kind of like a stooped, hunched over posture. And all these issues or difficulties with movement puts them at an increased risk for falls. So that's something you want to be mindful of. Also, you may notice what's called REM sleep behavior disorder. And this is basically where people start acting out their dreams. So they may start yelling and flailing in their dreams, which can put both themselves and really anyone else in the bed at risk because they don't have kind of that sleep paralysis, if you will, that most people have when they're sleeping. It's different. They have that REM sleep behavior disorder where they can actually move and act out their dreams, okay? Now, there are about 5 things that I want to talk about that are super important things to know and keep in mind when we're talking about Lewy body dementia. So 1, sleep disorders are pretty common in this population. So one we already mentioned was the REM sleep behavior disorder, but you may also notice excessive daytime sleepiness or insomnia or even restless leg syndrome, where the person feels like they just have to move to get some type of relief from whatever the sensation that they're experiencing in their lower extremities is. The second thing is that people with Lewy body dementia tend to be extremely sensitive to antipsychotic medications, and it can actually make things worse. So, for example, about 60% of people with Lewy body dementia who have taken antipsychotic medications experience worsening of the Parkinson's symptoms, sedation, impaired swallowing, or even neuroleptic malignant syndrome, which is basically where the person develops a fever, increased rigidity, and a breakdown of their muscles, which then can lead to kidney failure, which can, of course, be life-threatening, okay? The third thing is that in this population, involuntary functions tend to be out of whack. So there may be issues with them being able to maintain and regulate their blood pressure. And so they may be at risk for what's called orthostatic hypotension. And basically, this is a drop in blood pressure due to a position change. So, for example, laying down to sitting up or sitting to standing, okay? And so this may lead to increased dizziness or fainting. There may also be issues with incontinence and constipation, and even the loss of smell. They may also have difficulty regulating their body temperature, and so they have an increased sensitivity to like the heat and the cold. The fifth thing that I want to mention is that people with Lewy body dementia are at increased risk for depression, anxiety, apathy, agitation, delusions, hallucinations, and paranoia, okay? And so this is just something that you want to keep in mind because they are more at risk of being put on medications that may not necessarily be beneficial for them, okay? They may actually end up causing more harm than good. So it's just something that you want to be mindful of, okay? Now, the last thing that I just want to briefly mention for this episode is the role of palliative care for Lewy body dementia. Now, I personally am a strong advocate for palliative care for any person who's living with dementia. And because it is so misunderstood, a lot of people do miss out on its benefits. So, if you do want to learn more about palliative care and how it differs from hospice care, I did a whole episode on this. So, I'm going to link one of our previous episodes in the podcast notes where I go through this topic more in depth, okay? But essentially, palliative care is comfort care, and it's comfort care aimed at improving a person's quality of life. And it can be initiated at any time during a terminal illness, not like hospice care, where it's mostly the last 6 months of life, okay? And so palliative care can be especially beneficial for people with Lewy body dementia because of all the distressing symptoms that they may be experiencing, such as constipation or sleep issues or distressing hallucinations or delusions or any other behaviors that they might be exhibiting, okay? So with palliative care, there is this wonderfully integrated team that helps figure out the best way to relieve troubling symptoms, assist with medical decisions. They offer emotional and spiritual support. They help coordinate care for that person. And so it's really good, holistic, all-inclusive care for your partner, okay? So if you think your partner could benefit from this type of specialized care, or even if you just want to learn more about it, I strongly recommend talking to your partner's physician about it. And if it seems like it's in alignment with what your partner wants for themselves and what you would like for your partner, then I would ask the physician for a referral to palliative care, okay? Again, this can be initiated at any time during a person's illness, okay? It doesn't have to be just an end of life type of decision, okay? So that is all that I have for this particular podcast episode. As I always say, I really do hope that this podcast was interesting and informative and that you learned something of value. If you have any questions or things that you would like to share, you can always send us a voice message on whatthedementia.com, or you can send us an email at podcast@whatthedementia.com. Thank you so much for joining us on another episode of What the Dementia by Bambu Care. We look forward to catching you on the next episode. Take care, and until next time, stay strong, care on, and remember, you are not alone. Bambu Care is always here.